So I just exited my patient Harry's room. He's saying that he's in 8 out of 10 pain. So I had a look at his MAR, which has a PRN for morphine, and that is every 3 hours, which he hasn't had yet. So I'm going to give him that as a sub-Q injection. So I'm going to first enter the med room and pull out the morphine, which is 10 milligrams a milliliter, and it's not expired until December 2035. So that's my first check. The next thing I'm gonna do is the math. So his order is for 2.5 milligrams. So that's the dose desired, divided by the dose on hand, which is 10 milligrams, times 1 milliliter, gives me 0.25 milliliters. Okay, great. So I know the amount that I need to give him. The next thing I'll do is my 7 rights of med admin. So right patient, Harry Wilson. Right drug is morphine. Right dose, 2.5 mils. Right route, a sub-Q. Right time, it is 9:30 in the morning. He hasn't had it yet. It's his PRN med, which he can have 3 times today, so we're good for that. Right reason, 8 out of 10 pain. And then documentation, I'll put a dot here just to say that I'm drawing up the med. And I would double check with my instructor that the math is correct. So the next thing I can do is draw up the med. So I'll just make sure there's no air in there. And then I will use, actually I will do that separate. So first thing I'll do is get my go. And then I'll get my filter needle, put that on top. And then I will clean off the top of the ampule with an alcohol swab. And then use another alcohol swab to break it away from me. And then I can use my syringe and my filter needle to draw up 0.25 mils. Okay, and once I have the right amount, I will put the cap back on. I can take that off, and I can put on my injection needle. And then I will get rid of all the stuff and put it in sharps, and my third check will be just looking again that I have the right medication, which is morphine, and it's not expired. So that will all go in my sharps container. So the next thing I can do is prepare to go to the bedside. So we'll do some hand hygiene. And I've already prepared a label. So I'll put that on. Gloves on. And then I'll be ready to go to the bedside with the medication and the MAR. Hi Harry, how are you doing today?
Good.
So I have your medication here. It's the morphine, it's for your pain.
Okay.
I just need to get your first and last name.
Harry Wilson,
Okay, and your date of birth.
September 22nd, 1946.
All right, Harry. And do you have any allergies?
No, I don't have any.
No? Okay, so I'm going to just double check that's all right on his bracelet, which it is. No known allergies. And have you had this medication before?
Yeah, I've had it before.
You have, okay. So we're gonna do it in your abdomen. Is that where you usually get it?
Yep.
Yeah, okay. So we'll just lift that, and then to locate it, you want to go, you want to find the umbilicus, and then 2 inches away in one of the quadrants is where I can give the medication. So I will take that off, find my location, and then I will pinch the skin, and at 90 degrees, go in, and then I'll stabilize it with the other hand, push it in, and then pull it out and lock it. Okay, how was that, Harry?
That was good, thank you.
Okay, so I will be back to monitor you, and you can let me know if you have any problems with that, but you should be feeling better.
Okay, thank you so much.
Okay, and so I'll leave the room, or first I'll put this in sharps, and then before I leave the room, I'll just document, I'll document that with the time and my initials.